This is not a glitch like in the movie Matrix, a déjà vu, because there is the experience of people having the feeling that they've seen something, usually an animal or a person, repeating, appearing again. So I'm really here because the break is being delayed. We are not in a matrix, but we will dive together a little bit into the space and time different than the stable period. We will dive into liminality, and I will shortly explain to you what this is. Connected with the challenges in psychotherapeutic work with persons having sexual dysfunctions before and during COVID pandemic in Serbia and in general as well. So I will list you the problems we are facing in Serbia even before the situation with COVID appeared. And I was thinking, while having these notions in mind, are we facing the borderline situation or antinomia, to say it in Latin, antinomies? I will show you first the one side of the dimension and afterwards the other side of the dimensions on a long spectrum of issues we are dealing with in Serbia. So still, sex is quite a taboo in Serbia. There are a lot of prejudices and stereotypes. There are a lot of remains and consequences of the patriarchal system that is still quite alive, as I heard even in France, so in Serbia definitely. There is not, connected with that, of course, not enough gender equality. And later, if we have the time, I will make some comparison between Serbia and Finland, because I had the opportunity, thanks to COS, to have my STSM in Finland and to exchange the similarities and differences between the situation in Serbia and Finland, also connected with gender equality. Also connected with everything that I've already said, it is very questionable the right that women give to themselves, and they are being given by their partners to feel the orgasm and also not to fake it. I was completely surprised with my patients how many women still fake the orgasm from different reasons. And there are a lot of situations when sex is being done from the obligation, not because from some more essential reasons. Then still, there is an attitude of suspicion towards the researchers connected with sexuality. I recently had an unpleasant experience trying to expand the sample of my research to the Academy of Security, because they have much more male students, and I got the approval from one of the important chiefs of the department there, but when I was instructed to talk with the pro-rector about that, she just wrote me a short mail. Respected doctor, we are not in a position to perform your research. Nothing else. Then people in Serbia are avoiding still a lot to ask directly help for sexual dysfunctions. And connected with this, at my Institute for Mental Health, which is a very good institution, when I a couple of years ago tried to start the issue that I am very eager to work with sexual dysfunctions, psychiatrists and people who are working there asked me, some of them, of course, do we really need this? There are not so many sexual dysfunctions, and said, what? So luckily I pursued my cause, and I'm working with sexual dysfunction, so people now have the opportunity to come directly from this reason to ask help. There is not enough respect and tolerance towards diversity, no sexual education. There is, in the 6th grade of the primary school, one lesson of biology when students are being presented, pupils, very small children, presented about the anatomy of male and female body. And of course, there are a lot of sexual dysfunctions that we need to work with. But at the same time, in the same place on Earth, there are a lot of clubs for different sexual purposes. For example, swingers clubs, sadomasochistic clubs, black rooms, rooms for sex in the back of some clubs, usually gay clubs. There are a lot of persons involved in orgies, multiple partners without protection, and with a lot of misuse of psychoactive substances. There are a lot of sexually transmitted diseases, and not enough difference between imagination and reality. And I think this is a very important distinction to be made, not only while working with sexual disorders, but while working with any psychological disorder. And those videos that were made in Prague and that were shown yesterday were a great example how important it is to make for the people known that one thing is to have a fantasy about something, and the other thing is performing that. So during my work with my patient, that is one of the important things and the precondition for people to be open enough to acknowledge to themselves first their fantasies and then to share it with psychotherapists. And that is preventing the possibility, we were talking about that this yesterday as well, preventing the possibility of acting it out. If we put in between the fantasy and the before the action, if we put the psychological evaluation of what is going on in somebody's psyche. So obviously there is a lack of synthesis there. So diving into liminality in psychotherapy and in life in general, like Jacques was saying, we were communicating with all of people from all over the world. I was 2 days ago talking from a little bit different perspective into London's C.G. Jung club about diving into liminality while being in Salzburg. They were expecting me to be in Belgrade. Somebody was listening from America, so we are definitely being dived into liminality, whether we are aware of it or not. So what is liminality? Liminality comes from the Latin word limen, which means threshold or a doorway. The term liminality was well known in the early 20th century anthropology, and one of the persons who was working a lot with this issue was Victor Turner, and he was talking a lot about the status of people that were undergoing cultural initiations and rites of passages into adulthood. But there are a lot of other phases in between, some very stable phases during our life course that could be defined as liminal phases and spaces. I adore this image. This is the picture that was made, not a picture, but the art that was made by Japanese Shinio Mahi. He was dealing a lot with the liminal airspace time. And on the left side, you can see this organ, the instrument that is very stable. It has its form, its definite function, so it could be a metaphor of a very stable phase in our life, our personal or in general. And on the other side, you can see this silky, transparent curtain that does not have any stable form and that could change its shape where any influence from the outside is coming. So this could be a symbolic image for the liminality. And behind you can see the hint of a window or something else that is being outside, that is giving us a hint how the future could be, also connected with this situation with COVID, but we do not have the clear image and could not have how it will be after the pandemic. So this situation evokes a lot of different emotions, among others, insecurities, anxieties, depression, a lot of other symptoms. So we are finding ourselves somewhere, as English would say, betwixt and between. So in order to get from one stable period into another, one has to cross this border or limen and to stay there for a certain time. We can't jump just from one certain phase to another. So it indicates something like a zone of being between, a half position, a borderline space. So while the sense of I-ness and some of its continuities remain during liminality, the prevailing feeling is one of alienation, marginality, and drift. This is a quotation from one of the very important Jungian analysts, Dr. Mary Stein. So there are micro and macro liminalities and episodes, and I will focus now on this macro big phases of liminality because it is connected with what we are talking about. So it could evoke major changes, a massive reorganization of our attitudes, and could lead to more comprehensive transformations of our personality. But with this situation, with COVID, it can bring a lot of huge transformations in the relationships, sexual and emotional, between two people, between partners, also on the social level within one country and in the whole world as well. So what could be a trigger for this whole process? It could be triggered but by one-time encounter with the important transformative symbolic image in psychotherapy, like a dream image, for example, and more often by a stressful or traumatic event. So the situation with COVID could be one of these triggers. But since I am a psychotherapist, I always like to add some meat to the skeleton of theory and theoretical approach. So I will show you the example of my patient, how he was functioning before and during the COVID situation. So he came to me, of course, not directly because of his impotence, because it was not possible, but he came because he was having something like a panic attacks during nights. He would be woken up by speed and rhythm of his heart, by his pulse was accelerated. He thought that he would die because of heart condition or some other serious disease, and he couldn't connect that with anything. And he said that he had almost perfect life. He was having a girlfriend, a job for a good firm from abroad. He was having his apartment in the house of his parents. So he couldn't see any connection. And then he had this dream with the perfume shop. So he said, I'm in a fancy perfume shop with my girlfriend. Everything smells great. We are coming back to the smell, like from the lecture yesterday. Sales girls are going around spraying all those perfumes. Everything looks beautiful and great, but suddenly I need to go to the toilet. And I can't see toilets anywhere but in the middle of the perfume shop. So he can't resist, he has to sit there, and then it starts to smell terribly. But everybody else is pretending like nothing is happening. Girls are going around spraying perfumes, but he cannot avoid anymore seeing those shitty situation he finds himself. So this was the trigger for him to go from the surface and to dive into the liminality and to start questioning, re-questioning his sense of his perception of himself, of his relationship with his girl, etc. So then we found out that his relationship, sexual and emotional, with his girlfriend was far from perfect. She didn't let him kiss her, only what Italians would say baci baci, very superficial kisses, without any tongue, without the possibility of getting deeper into emotional state and getting in touch with passion. And she also wasn't allowing him to touch her. She was only interested in a very hardcore sexual experience, but he, as not a typical representative of a stereotypal male figure, he couldn't do anything. He became gradually completely impotent because he was lacking something else, something more substantial for himself. So before the time of COVID, when everything was, people could approach each other, he could not have any real contact with another person. Then the girl braked with him, so he was very interesting for other girlfriends, but they were very dominant, aggressive, active, feminine type of women, young women, and that was too much for him. There was not enough distance, so he would get frozen as they were push and jump onto him. So that was his situation before COVID. And this was another interesting dream that he had a little bit afterwards. It is also very symbolic. He says, I'm with my horse, we are dead, and not somehow at the same time. I'm afraid that some bad guys could kill us again and for good, so I'm hiding from them. At the same time, my horse is running around looking happy just because he's jumping and having fun on that nice meadow we are in. I'm becoming very anxious because he's jumping around. He will direct the attention of the people who want to kill us again. So I'm telling him that he needs to pretend being dead. He's not listening to me. He's happy to feel alive, so I'm scared even more. So here you can see how divided he is from the inside. There is something in himself that wants to be potent, alive, spontaneous, and on the other side, the other traumatic part within himself that wants to take a low profile at any cost and pretend dead, like animals are doing that when they are feeling threatened. So basically, he was caught in a negative mother complex because he was having a mother who was quite dominant and aggressive towards him, and he was just repeating the pattern that his needs were not being met, also with his partners that he was having till then. So what are the challenges of something that came with COVID, with online psychotherapy and with online love as well? We psychotherapists in different societies are talking and thinking a lot about these dimensions of are we dealing with far away closeness or close distance when we are talking about online analysis. Of course, I can explain you everything more if somebody will be interested afterwards. So are we dealing with visual and or auditive channel of communication? What are we doing with absent corporate or absent body? So is it privacy reduced or enlarged because we are getting into patients' apartments, seeing everything that is behind them? So what about lost tactility out of psychotherapy as well? And about that dimension about visible face and invisible body. So we now have shared temenos, or a secure place of psychotherapy that is made from a patient's and psychotherapist's space together. And it is also interesting to see where are the patients placing their own image in relation to ours when they are looking us into the screen. I had recently one very interesting experience related to this. So these are the additional autonomies related with COVID and the new reality of life and psychotherapy. Those are, we are constantly floating between certainty and uncertainty, between impotence and potence or even omnipotence, between loneliness and sharing, between technology and human relationship. But we don't have only bad consequences, because each crisis could be a chance to learn something new about all those possibilities that I wrote below these antinomies. And if we are modest enough and open to learn from this experience and to experiment more, to make more improvisation, we can find some new modality that could be much more helpful for our patients. So connected with improvisation, I could not resist to tell you some quote from jazz musicians. This was from Wynton Marsalis. He said that improvisation is freedom of, I will have to read it from here because I can't see.
Please take your microphone.
Yes, I have to take my microphone.
No,
Where is my text? Okay. I wouldn't like to make a mistake. So improvisation is the freedom to express yourself. Swing is the us, diplomacy and balance. Blues is optimism in the face of adversity. Generosity of spirit and depth of feeling we call soul. So I think that new reality of psychotherapy demands improvisation and integration of what we have learned from this COVID experience. And why am I talking about jazz? Because jazz is a wonderful metaphor for me, for life in general, for psychotherapy, for the process of individuation, and the process that is going on in the interactive field between us and our patients. So if you allow me, I will shortly finish you the story about my patient that was happening after the COVID began. So, while he was being in the same city with the girlfriends, nothing happened. Online sex with unknown women, nothing. Because he was trying to play roles of being with the mother and him being a younger boy, to repeat that pattern and to learn something from that. But because those unknown women were having quite aggressive demands, it wasn't resonating with him, so he could not learn anything from that except from being frustrated again. But when COVID began, he met a new girlfriend who almost immediately after their first date, where they were kissing with tongue and everything, but not having sex, meaning intercourse, and he was completely enjoying. He got frozen because what if he stay impotent with her? And then she needed to go abroad to finish her PhD thesis. So I said, maybe that is not such a bad thing, because that will give him a safe enough, optimal distance to start gradually involving with her sexually and emotionally. So they first started typing messages, and he was feeling good, he was excited, he was having erection, and he was getting closer to her. Then I suggested him, okay, you can start listening to her voice. Maybe that could be more stimulating for you. And also you can get adjusted to her voice, not to be scared when she comes back home. And gradually he also included the visual stimulus. So since they are both very, very subtle persons, there was not any explicit material shared on, but the expression of faces and everything. But when she came back, he was being able to connect her with in a much more deeper level, in emotional and sexual as well. So this image I liked very much. This was from the internet, somebody sent me. You can see this wall or a door with this thing. And it looks like the blockage is so huge that nothing could be made of it. But then you can see the reflection that is making a shape of a heart. And for this person, something that looked for some other people as a great obstacle of not being able to have a direct contact with another human being, helped him to give him enough space and enough distance to start to heal his trauma that he was having. He started to establish a relationship with a more positive motherly figure, because this girl was very nurturing, and he was the first person who had actually a little girl. So she really had that nurturing aspect, and also she was his lover. So he was starting to connect with what we Jungians say, the archetypal image of the mother lover. That is not a very rare situation. So I will just come to the last slide. I will read this because it is more clear. Another amplification from jazz. Charles Mingus said it. Making the simple complicated is a commonplace, but making the complicated simple, awesomely simple, that's creativity. And we were also talking about this issue, Marianne. Exactly that, among other things, is our job by working with sexual and other disorders. Not by imposing the common solutions, simplified ones. For some people that could be very helpful, but by respecting individuality of persons and their authenticity in sex and in general, and thus helping them to find, through complexity, their own simplicity. Thank you. I will stop here.